Love is complicated. That's why there's a full 50 ways to leave your lover.
50 ways to leave your lover.
But knee pain, fortunately, is much more simple. In this video, I'll review the 8 ways that you can leave knee pain behind for Christmas. With these 8 options, everyone's knee pain can be improved or even cured. All you need to know is where to start. Number 1. As you know from our other videos on knee pain, treatment starts at home with RICE: rest, ice, compression, and elevation. A neoprene sleeve, or just an elastic sleeve, is really a terrific way to get the compression. Sleeves are available in most drugstores like Walgreens or CVS, and you can even order them these days right off of Amazon. A sleeve for your knee also limits the range of motion. That can be really helpful at first, but clearly it's not the long-term solution. But if there's one activity that tends to really hurt your knee, like taking a long walk or getting out in the garden, then try the brace during that activity and see if it solves the problem. If it does, Merry Christmas, you're done. Number 2. All right, let's say you have knee pain despite 3 weeks of RICE at home, then it's time for an x-ray. Serious underlying problems of knee pain like infection or tumors or broken bones are really rare. But they have to be ruled out, and an x-ray is a quick and easy way to do that. But honestly, the real use of x-ray is that you get a sneak peek at any arthritis that's hiding in your knee. Everyone of a certain age has some degree of arthritis. The amount of arthritis is what's going to determine on your next 5 options which one is right for you. Now, the radiologist will rate your arthritis 0 to 4 in their report. That rating of your knee arthritis is a really good number for you to know. So take a minute, look up the report, and check it out. Number 3. Physical therapy really helps. If there's something in your gait or your station that's making your knee work harder than it should, physical therapy is the way to go. Whether you have a physical issue or not, it's really wise just to get an outside pair of eyes on what's happening. A great physical therapist is a wonderful ally in the fight against knee pain. But structural problems like a torn ACL, the anterior cruciate ligament, or meniscus, not to mention arthritis, may be just simply too severe to get better with therapy alone. So 2 visits, 3 weeks, that's usually enough to give therapy a realistic chance of making you better. If after those 3 weeks you still have pain, then it's time for number 4, magnetic resonance imaging. X-rays show bones, MRI shows soft tissues. Now, the 2 big soft tissues that you want to assess in your knee are the ACL, the anterior cruciate ligament, and the meniscus, of which there are 2 in each knee. MRI is diagnostic. That means it's going to tell you what to do next. But just like the X-ray, you want to get that study. The MRI report is crucial to orient yourself as to your next step. All right, now we've reached number 5. If your X-ray shows moderate arthritis, then it warrants a hyaluronic acid injection. Now, I myself once had a steroid shot in my knee, and it really helped. I wouldn't do it again. I'll tell you why. A new study from the University of California at San Francisco shows that steroid injections into the knee make the MRI findings of arthritis worse over time. A lot of people suspected this, but until now there's been no proof. The same study, by the way, did show a real benefit to hyaluronic acid injection in the knee. Hyaluronic acid injection reduces pain and the progression of arthritis by providing that lost lubrication for your knee. The OG hyaluronic acid is Synvisc. You've probably heard of it. But these days, there's 4 or 5 additional forms available. Honestly, most insurance companies negotiate a volume discount, and these compounds are expensive. So most people just take the one that their insurance has on the formulary, and that's a good way to go. Number 6, if MRI shows a torn meniscus or torn anterior cruciate ligament, then you may need arthroscopic surgery. We all want the best. but arthroscopic surgery of the knee should be done by an orthopedic surgeon who is certified in sports medicine. For more information on finding the right surgeon, check out our video on the topic linked in the description. Number 7, severe arthritis, once it's been verified by X-ray that it's failed conservative measures like physical therapy, can only be reversed with total knee replacement. Well, 1 in 20 cases of arthritis is so localized to a single compartment of the knee that you can actually treat it with partial knee replacement. But the vast majority of knee replacement, 19 out of 20 these days, are total knee replacements. And again, you want the very best. You only get one chance to do it right the first time. The best knee replacement surgeons are fellowship trained in joint replacement. They do hundreds of these surgeries every year. You'll be happy to learn that you don't have to go to the hospital for a knee replacement even. When Kris Jenner needed a new knee, she had the procedure done in an ambulatory surgery center. You should insist on celebrity treatment too. I mean, the last thing with knee replacement you want is a surgeon who is not really the best. And the best means a muscle-sparing approach. They always use a robotic assistant. And third, registry-proven implants. Just like Kris Jenner did. I mean, most people, around 83%, literally double their risk of surgery by choosing the wrong surgeon. Again, call us. We can help. And finally, number 8. Number 8 is genicular radiofrequency ablation. The genicular nerve supplies the pain fibers to the knee, and it doesn't do anything else. So ablating the genicular nerve can actually reduce knee pain without affecting normal sensation or strength in any way. Genicular nerve ablation is hit or miss, and honestly, the relief is at best temporary. So this treatment is often reserved for those who are too sick for traditional measures, or if the rare person who actually underwent total knee replacement and still has pain is also a good candidate. Living with knee pain is restrictive and it seems complicated, but again, with today's treatments, almost all knee pain can be improved and many cases actually cured. Make this your last Christmas with knee pain. For best practice, I'm Dr. Dan Lieberman. Happy holidays.